Good afternoon and welcome to the St. Clair County EMA briefing. I'm joined today by EMA Director Herb Simmons. We're going to go ahead and get right into the numbers. Today's numbers are not good at all, and we're going to have a little bit to talk about once we're done with them, but we'll start by giving you the information. In St. Clair County, we tested 124,174, which is an increase of 1,368. For positive test results, we've had 10,134, which from yesterday is an increase of 192. That is our highest one-day increase ever here in the county. Those are males and females under the age of 10 to their 90s. Our daily county positivity rate today is 14.0%, and that brings our county 7-day rolling to 10.7%. For negative tests, we've had 114,040. We are happy to report that we have no new additional deaths in St. Clair County today, so that number does remain at 229. For those that have completed their IDPH required 10-day isolation period, we are at 8,849. For state numbers, the state has tested 8,313,547. Positive test results is 477,978. Which is a state increase, also the highest ever, 12,438 new cases since yesterday. Unfortunately, the state is also reporting 76 new COVID-19 related deaths, bringing that total to 10,154. For hospitalization numbers, here in St. Clair County, those hospitalized with COVID-19 related illness are 73 patients, and 8 of those patients are on ventilators. In our region, we have 121 COVID-19 related patients, and 17 of them are on ventilators. For our congregate living facilities and outbreak status, which is 2 or more staff or residents at the facility, we will only announce the changes today, and those are Cambridge House in O'Fallon has 8 cases and 0 deaths, which is an increase of 2 cases, and Lebanon Care Center has 79 cases and 12 deaths, which is an increase of 1 case. And I'll now turn it over to Director Simmons for the zip code report.
Thanks, Brian. And we've got quite a few zip codes to go into today, so we'll get started on them. 62201 goes up 4 to 317. 62203 goes up 4 to 301. 62204 goes up 4 to 187. 62205 goes up 2 to 268. 62206 goes up 6 to 563. 62207 goes up 3 to 301. 62208 goes up 15 to 598. 62220 goes up 17 to 742. 62221 goes up 31 to 934. 62223 goes up 15 to 631. 62225 goes up 1 to 49. 62226 goes up 26 to 1,086. 62232 goes up 8 to 271. 62239 goes up 5 to 152. 62240 goes up 1 to 53. 62243 goes up 14 to 179. 62254 goes up 5 to 322. 62255 goes up 1 to 22. 62257 goes up 3 to 67. 62258 goes up 16 to 297. 62260 goes up 15 to 217. 62264 goes up 2 to 120. 62269 goes up 35 to 844. 62282 goes up 2 to 23. And 62285 goes up 17 to 193. And you heard Brian say our daily positivity rate is at 14%. The 7-day rolling is at 10.7%. And our regional positivity as of November 4th is at 11.3. It's going way in the wrong direction. The daily county positivity reported by IDPH for the surrounding counties in the region today is Bond comes in at 18.8%, Clinton comes in at 19.6%, Madison County 14.8%, Monroe County 13.9%, Randolph 12.2%, St. Clair at 12.5%, and Washington at 10.5%. Brian, the number's definitely not going in the right direction.
No, and we talk about this all the time, and we see it on the page, and it actually gets quite frustrating at times because everyone on there, oh, it's only affecting the elderly, it's only affecting those in nursing homes. Today we have 192 new cases with only 3 changes in congregate care facilities. That means there's 189 people of community spread throughout St. Clair County. You announced every zip code today with changes except for 2. So this is all over our county. We talk about age groups. Today there are 90 new cases under the age of 40. And a good majority of those in our school-age children. We have all got to step up and do better. You know, I've seen it when I've been out in public. People choosing not to wear a mask or not to social distance. And the choice is hurting everyone. It's hurting themselves, it's hurting their relatives, and it's hurting businesses. If this doesn't get going in the right direction, we're going to see more businesses suffering because we're going to wind up experiencing, most likely, more closures.
Well, and that's the thing, and at Monday we'll be on a conference call, and of course, you know, we'll wait and see what happens on that. But, you know, for 239 days, we have brought this briefing to you, and I've said this time and time again, we have brought patients on here who have been affected by the virus. We brought the medical experts on here. We brought hospital CEOs on here. A wide range of people have come on here, paramedics, nurses, and everybody has been pleading. And Team St. Clair, I say this every day, yous are stepping up, but there is now it's showing a large percentage of cases throughout the county, throughout the region, that people aren't taking this serious.
Well, we heard it the other day from one of our followers that was a nurse, and she said, we're tired. They have been dealing with this 24 hours a day for more than 239 days, and they need help. They need the public's help. You know, we're seeing some of our hospitals stopping elective procedures again to make sure they have capacity in their hospital for cases. We've heard from the hospitals that when people are finally coming to the hospital now, they're coming in much sicker. And it's taking more staff and more equipment to treat them. And I'm just afraid without everyone's help, we are moving very quickly in the wrong direction.
Well, and then the frustrating part is what you said, and I can tell in your voice, it does get frustrating because we're sitting here every day doing these numbers from the health department and putting them all together to try to get our information out to you, the followers of these briefings, and we appreciate that. We appreciate you sharing it. But, you know, then when we get comments like yesterday, well, it's just another older person that's passed away. You know, how rude. It's just terrible.
And you can say a good majority of the people are following the regulations. They're wearing their mask in public. They're doing what they got to do. There's times you can walk through a store and every person in there has a mask. But that doesn't mean that night they're not going home and gathering with 20 of their friends around a bonfire and nobody's wearing a mask. I mean, this has got to be a time where people are thinking about this virus 24/7 and how it could affect their family. We have seen young people get sick. We've seen older people get sick. We've seen young people pass away from this virus. And, you know, there was a conversation the other day about comorbidities and did someone die of COVID-19 or was COVID-19 a factor? What they're seeing is this is escalating other conditions people have, those with diabetes and various other conditions, that it makes that condition worse. And it unfortunately has caused the deaths of 229 residents here in St. Clair County.
Well, and the message that we give you every day, and we're going to give it to you again today, with the holidays coming up on us, we know everybody wants to get their families together. That's just what we all do. We've done that forever and ever, but you've got to use some good common sense on this. You've got to make sure that you know who your bubble is. We're seeing more and more of this community spread. Neighbors getting together, as you said, having bonfires, all that type of stuff. You got to know who you're doing that with,
Well, and every one of us knows a nurse. Every one of us knows a restaurant worker. Every one of us knows a school employee. If we're not going to do it for ourselves, do it for them. Let's keep them working. Let's keep them safe. And let's give some of those people a break. Those healthcare workers that have been doing this nonstop, let's help them out. Let's get our restaurants and bars back in business. Let's keep our schools in attendance. But we can only do that by working together.
Well, it's, as we said, we got to get the horses all pulling in the same direction. And we need each and every one of you. Team St. Clair, please continue to share these briefings. Tell your friends, your neighbors, pick up the phone and call them and tell them, it's time to get serious. I mean, the numbers are going higher and and they're going up quick. And the higher they get, the longer it's going to take us to get back down below that 6.5. And if more mitigations come, and we know there are people out there that say they don't care about the mitigations, that they're not going to do this, but the business people, think about your businesses out there. Support the businesses the best way you can, but the best way to support them is help get this thing stabilized, help get it under control, stop the community spread of it, and you do that by washing your hands, wearing your mask, and watching your social distancing. Support those businesses, and together we will get this done. But if these numbers continue to rise and more mitigations come, we're going to be farther and farther down the road, and we won't get caught up with it. So please, think about that tonight when you're sitting around there. As Brian said, 229 of our county residents aren't here to make those decisions. Statewide, 10,154 lives have been lost, and it's climbing daily. So please, spread the word. Team St. Clair, continue to do what you're doing. For those of you who are still not the believer that this isn't real, it's the cold, it's the flu, you are so wrong. It's just terrible. There's enough scientific evidence out there to prove. I mean, look what we're faced with now. It's everywhere. And we all have to realize it's going to be here until at which time there's a vaccination that comes around, which hopefully is going to be real soon. So please, please step up and help us get this thing under control. We'll be back tomorrow for day 240 with some numbers, and hopefully they'll going to start going back down. Have a good evening.
Mask, gloves, soap, scrubs, TikTok, Grubhub, Twinks, Jocks, Bears, Cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay inside and lock